Right now, Dr. James McDonald taking the helm at the Department of Health while the state searches for a permanent director.
And Dr. McDonald joins us now live via Zoom to talk about the new role. Okay, so Dr. McDonald, how does this change, or maybe it doesn't, how does it change your day to day?
Yeah, it really does change my day a little bit because I'm the director now. But really, the main thing it doesn't change is I'm just here to help. And, when you really think about what we do in state service, it's about serving other people. It's about the noble task of public health. And really, quite frankly, what I'm going to do every day is what I've always done, which is try to help Rhode Islanders to be healthy, stay safe, and get through this pandemic and deal with the challenges of the future. That's what I'm doing right now. But that's what I've been doing for the last 10 years.
And Dr. M, you were a little coy earlier today at the briefing about whether you would accept the director's position full-time if offered. Since you're on the search committee, would you have to recuse yourself from being a candidate if you made that decision?
But what I'm really trying to do is just help the governor and really help the search committee make the best decision possible. What I'm interested in doing is helping the state make the best decision possible during a very challenging time. So I'm not trying to be ambiguous with anybody. I'm just saying my role right now is to help the governor find a permanent director. And really, that's what I'm trying to do. And really, when you think about what my personal career looks like, what I'm about is state service. I'm really just trying to serve the people of Rhode Island. And I just need to evaluate what's the best way for Dr. Jim McDonald to do that? Because I already have a pretty substantial role at the Department of Health. So let's see how this goes together.
You clearly know the department and the inner workings very well through the new lens that you're looking at today. Is the department operating as efficiently as possible? Is there something right away you're saying, okay, we need to tweak this, we need to take a look at that?
Yeah, so the director has left a very strong health department. There's good people who do great work here, but it's not like there are any revisions need to occur. My job is to get at the helm of the ship and just keep navigating through the pandemic and support the team as best we can. But the department already has great people. And this is a credit to the director. She was big into leadership development, casting a strategy for the department, and alignment. So everybody knows what they're doing. So we're moving fine. We aren't going to skip a beat. Things are going along great.
Obviously, we need to talk a little bit about COVID. It's the ongoing pandemic, of course. We've been talking about Delta, Omicron. Are you looking, is there another variant out there, or are we kind of getting over that hurdle into better shape?
Yeah, so we sequence quite a bit. So we're always looking to see if there's a new variant out there. You're going to see things pop up in the news. They may not be a variant of concern. There's conversation about BA2. We haven't seen that yet in Rhode Island, but it's not even classified as a variant of concern. But, please rest assured that we do a lot of sequencing. We're doing our part as part of the global public health community, and I mean global, to look for new variants and just classify what's out there, and then everybody can benefit from that scientific work.
Looking at the most recent data, cases and hospitalizations are trending downwards. I'm curious, are we through the Omicron surge, and do you think that's going to be the last big wave that we see?
Yeah, we're past the peak of the Omicron surge, and we're heading in a really good direction. I think we're heading stable. It's hard to predict if we're not going to have another peak because there's a lot of letters left in the Greek alphabet. We could get another variant, so that we have to be careful about. But I think this underscores right now what we can do. If we would all just get the booster vaccine, because right now only 36% of us have had the booster. We need to not just get through this Omicron part of this, but we need to prepare for what could happen next year and next fall and throughout the summer. So we just really need to get everybody boosted. And, if there was one plea I'd have, if you really want to say, what can I do to make Dr. McDonald successful, is please get that booster vaccine. That's the one thing I'm asking you to do. If you could do that for me, you would literally make my day.
All right. And Dr. McDonald, just quickly before we let you go, last time we spoke, you had projected St. Patrick's Day as being sort of the end of this thing. Is that still what you're thinking?
Yeah, I still think we're heading on schedule for that. And I think you're seeing the cases decline nicely. The rates are coming down nicely. Hospitalization numbers lag in that regard, but they're heading in the right direction too. So we'll see what happens, but I still like our positioning here.
Dr. Jim McDonald, now the interim director of the Rhode Island Department of Health. Thanks so much for joining us on your first day.
Thank you, Brian and Kim. Have a good Thursday. Keep us all safe.